So, good evening, everyone. It gives me great pleasure to welcome you all today for this session. I'm Samina Kausar, CEO for Ethica Work Life. We have been relentlessly working for the past 9 months and over that to put together a host of well-being events for you, focusing on different aspects of your well-being and happiness. And today is no different. We have a very special event organized for you. The month that we are in today, that's January. January is a month of thyroid awareness. You will be taken aback or surprised to know that recent research studies have shown that one in every Indian, yes, one in every Indian is suffering from any different types of thyroid disorders. And this is an alarming statistics. But this is not to scare you. I also have a good news that there are measures and tips to follow to alter your lifestyle that will help you stay in the other nine, which means the other nine healthy individuals. You can be in that by following certain measures and tips and having adequate amount of awareness levels about thyroid. And to do this, or should I say to answer the hows, whys, and whats about it, I have a specialist with me. I have Dr. Soumya Bundalapati. She's an MD in internal medicine and working as consultant with Continental Hospitals. She brings about 10 years of experience, extensive experience in treating and managing thyroid patients. She's also attended several conferences and has also been awarded as All India Best Thesis Award for her research work. So without any further ado, let me bring her in. So Dr. Soumya, welcome. Welcome to the session. We're looking forward to a very insightful and interactive session. Thank you so much for being a part of this.
Thank you so much. Introducing myself, I'm Dr. Soumya Bundalapati. I work as a consultant physician for Continental Hospitals, and I'm so glad to be between all of you, just trying to create a small awareness of how to prevent and how to take forward the secondary preventatory measures that for all those who are already suffering from thyroid, and as a primary prevention for those who haven't been detected on thyroid, on how to prevent yourself, and by small lifestyle modifications of how you can avoid getting onto treatment. And thank you so much for getting me on board for giving a talk on thyroid disorders, and I'll try my level best to keep this as interactive as possible. I would say that you can actually ask me questions in between rather than stopping yourself for the first 45 minutes and asking me at the end. I would rather be happy to share the knowledge what I have to make the best possible way to make you understand on thyroid disorders. So coming to thyroid disorders, thyroid is a gland which releases hormones, and these hormones are very necessary for a vital functioning of most of the cells, or in fact all the cells in every particular organ of our body. Thyroid being one of the largest Thyroid is the largest endocrine gland in the body, which is in the shape of a small butterfly with the right lobe and the left lobe connected by isthmus. So this isthmus and the right and the left lobes of these glands is what it makes look like a butterfly. So why is it very important that I am talking about the right side and the left side? Sometimes when you go to a doctor or when you hear that you have a small swelling of the thyroid, sometimes it may not be limited. Sometimes it is not like the whole gland is enlarged. It may be only limited to a small portion in the right side or a small portion of the left side. But on average, when we look, this whole thyroid gland being involvement is a little rare, though we find a lot of cases. So in adults, it is approximately around 160 to 180 grams, and it is right below your Adam's apple. So once your thyroid gland is enlarged, you will be able to see through a naked eye, and you will be able to feel when you try to palpate it with three of your fingers. But you'll be able to palpate or see only when it is enlarged. Coming to the hormones that this thyroid gland releases are T3 and T4. So whenever you have a chance or whenever you go for a health checkup, you find that there are three different parameters that you find in your thyroid report. The mainly being TSH, T3, and T4. So how are they important and what are they is what I'm going to tell you now. So T3 and T4 are the main hormones which the thyroid releases. And these T3 and T4 are regulated by thyroid stimulating hormone, or rather noted as TSH. But there is another one called TRH, that is a thyroid regulating hormone, which is released not by the thyroid, but it helps in the release of thyroid stimulating hormone. And from where is this TRH? It is directly from the pituitary. So we call it as hypothalamus. You can see here that this TRH will regulate the release of TSH, and this TSH will regulate the release of thyroid hormones, that is T3 and T4. And for thyroid, the most important being the TSH and the T3, T4. But when there is no TRH, or when there is no activation or a feedback from the TRH, the TSH and T3, T4 have no role to play, or they do not have any functioning. So what is this TRH? TRH is another regulating hormone that is released by the pituitary gland. So what happens? This, when the T3, T4 are little abnormal, either less or more in your body, it stimulates the pituitary for the release of TRH. So what happens is when this TRH is released, it in turn leads to the release of TSH. And the TSH directly releases T3, T4 hormones. So when we have low T3, T4, like in a hypothyroidism cases, like where we have a low T3 and T4, which is not adequate for the metabolism of our body. So that is when the TRH senses and it keeps on stimulating the release of TSH. When this T3 and T4 are low, I mean high, I mean when they're really high, I mean excess to what is required to the body, it sends a feedback mechanism to the TRH, which suppresses the TSH, saying this is enough for, I mean these hormones are enough for the metabolism that is required by the body, so it suppresses or decreases the TSH. Am I clear till now? Hello? Ms. Samina, am I clear
Yes.
and audible?
Yes,
Is
yes,
it
you
going
are
well?
audible. Yes, doctor.
Is it like clear to everybody?
Yes, it is clear.
Okay, thank you. So this is what I was trying to tell you in the previous slide, and it is a little more clear in this. So this is the T3 and T4 hormones which are going to be released. If they are normal, that is normal enough for the functioning of the body, it sends a signaling to the pituitary, which in turn regulates the TSH. So when the T4 is normal, TSH is also normal, then we call it as a normal condition. When we talk about the functioning of, when we talk about the disorders of thyroid, there are two different types of disorders. One is relating to the structure of the thyroid. Second, relating to the function of the thyroid. That is, in a normal terminology, I can say how the thyroid looks and what it is doing. So now coming to the functionality of the thyroids, there are two conditions, that is hypothyroidism and hyperthyroidism. Hypothyroidism is nothing but the T3 and T4 hormones are way low than what is required. And hyper is T3 and T4 are high in excess than what is required. So when there is an excess T3 and T4, it suppresses the TRH. There is a signaling to the TRH. TRH suppresses the TSH. So the TSH is low, and the T3, T4 hormones are high. This is what you read in your blood reports, that both of them go in opposite directions. In hypothyroidism, your T3, T4 hormones are low, whereas to stimulate or to increase the T3, T4 hormones, the TSH is abnormally high. But in hypothyroidism, there are two conditions, like what I was talking about, pituitary gland, which is necessary in the releasing of the stimulating hormone TSH. If there is a problem with the pituitary where the TRH is not able to get regularized, then we have a low TSH because it is not able to stimulate, and because there is no TSH, there is low T3, T4. So, yes, how are these T3 and T4 formed? How is it that it is important? So, whatever iodine that we absorb, that we take through our diet in the form of salt or any other foods, it is only the thyroid gland and the thyroid cells that can absorb these iodine and combine with a couple of amino acids and make T3, T4 hormones. So the amount of iodine that we include in our diet are very important. So these T3, once these T3 and T4 are formed, they are released into the bloodstream and they help in the metabolism of each and every cell in the organ. It regulates not just the vital organs, but every organ, coming to the skin, to the heart, to every organ that you can mention. There is an impact by these 3, 4 and T3 and T4, because they are very vital in providing energy that is sufficient for every cell. So, like I mentioned, the thyroid disorders, there are various types of thyroid disorders. First, relating to the structure, that is how it is looking. So, sometimes the whole thyroid gland may get enlarged, which is called as goiter. It is very evident, like when we see a couple of people whose neck is slightly enlarged, or when the thyroid gland is very noticeable, we ask them that if they're suffering from hypo or hyperthyroidism. That is nothing but goiter. There are a lot of patients who present only with goiter without any functional changes in thyroid. Second, coming to the structure, there may be nodules, that is only a part of the cell, only a part of the gland, the right gland or the left gland may get enlarged, and may function excessively, or they may stop functioning. That is where these thyroid nodules come into picture. Second, coming to the functioning of the thyroid disorders, that is the hypothyroidism or hyperthyroidism. To be very clear and specific, and for you to for everybody to understand, let me make it clear. Hypo is less functioning thyroid. Hyper is nothing but overactive thyroid gland, which is releasing excessive hormones beyond the capacity of our metabolism. So these thyroid disorders are very common in women. The reason partially unknown, but maybe because of the genetics. It may affect, it doesn't mean that it doesn't affect the men. It does, it can affect men, youngsters, children, anyone of any age and any gender. So these are the types of or various kinds of thyroid disorders: hyperthyroidism, hypothyroidism. Goiter is nothing but the enlargement of the thyroid. Hashimoto's thyroiditis. Hashimoto's thyroiditis is nothing but the thyroid acts as the thyroid gets filled with a lymphocytic infiltration. That is nothing but it acts as a foreign body to our immune system, and this immune system tries to destroy our own natural normally functioning thyroid cell, and it is an autoimmune condition, and most of the times this is not this is not preventable. Coming to Graves, this is also presented as goiter, but this is like severely hyperactive thyroid. And thyroid nodules, as like what I've told, the nodules can be benign or malignant. Malignant in the sense cancerous nodules, benign in the sense non-cancerous nodules. I'll go one by one. We'll start with hypothyroidism and then go into hyperthyroidism. Hypothyroidism is nothing but underactive or very low active thyroid gland. That is, the T3 and T4 that are released by the uh, thyroid are not metabolically enough to keep us running. So, when the metabolism is decreased, you have tiredness, excessive fatigue, and you have decreased heart rate. You are very dull, low. You have you don't feel, I mean, because there is no metabolism, you have a feeling of excessive cold, that is sensitivity to cold temperatures, body pains, and you may have delayed periods, very decreased flow because there is no much metabolism. So these are all the symptoms of hypothyroidism, and the main symptom coming to weight gain. So I frequently see a lot of women or men who come into my clinic who just get a thyroid test done just because they are a little on the healthy side or an overweight, or they're not or they're not able to lose weight. Weight loss or weight gain or unable to lose that proper weight is not the whole and only symptom of hypothyroidism. The hypothyroidism has a multiple symptoms which we need to be aware before we go for a thyroid testing. First thing, a family history of any thyroid issues, anyone in the family who's taking thyroid medication. Second, weight gain, weight loss leading to any cold intolerance. Third, dry skin, hair fall, loss of texture of the hair, excessive tiredness, unable to cope up with your normal regular activities, or you have any trouble sleeping. So these are the main symptoms of hypothyroidism. So what are the main causes? The main first cause that we need to see is the amount of iodine intake per day by that particular person. First. Second, autoimmune problems like Hashimoto's thyroiditis. So you need to ask for a family history. Third, if the patient has undergone any surgery for the removal of thyroid, or any thyroid cancers, or any radiation treatment when the patient was having Graves' disease or any other problem. So once we suspect the thyroid or hypothyroidism clinically, that is when we go into diagnosis. So when we do a physical examination, there may be swelling over the neck, dry skin, very slow heart rate, and that is when we do the TSH and T3, T4 hormones. What happened to this? What happens to this T3, T4 hormones? The T3, T4 hormones in hypothyroidism are decrease, like what I said, and to regulate these hormones, the TSH is increased. So what do we do once we confirm a case of hypothyroidism is we start on replacement of these T3 of these T4 hormones, and we keep a check every 3 months. And if the TSH is abnormally high on the first visit, we ask them to come every 4 to 6 weeks for a thyroid checkup till we can calculate or come to a proper dosage. Coming to hyperthyroidism is nothing but production of excessive amounts of thyroid hormone which are not necessary for the body, or which cannot be shed off by our body. So what happens when your metabolism is very high, like, after you come out from the gym, or after you come out from the workout, it is the same feeling that that a hypothyroidism patient have. That is nothing but excessive muscle weakness, tremors, excessive sweating, more anxiety episodes, very very rapid heartbeat, or abnormal sensation of heartbeat. Then sorry, but this is not skin dryness, but you have moist skin because you're always sweating. And because the metabolism is abnormally high, You may have weight loss also. So what are the causes for these hyperthyroidism? Is the most common is autoimmune disorder, in which the Graves' disease, in which the T3 and T4 are abnormally high, and to regulate this, the TSH goes abnormally low. That is, they both go in abnormal directions. So the other main causes when we are talking about hypothyroidism is we need to see if the patient or anybody is having any drugs which increase the iodine or which contains iodine. Yes, and once this is done, then we go for a TSH, thyroid hormones, and then we get one ultrasound of the neck done to see if there is any goiter, that is nothing but increase in the size of the thyroid gland. And what do we do once the hyperthyroidism is confirmed is we start them on medication, that is anti-thyroid medication of methimazole or propylthiouracil. So what happens after you start these medication? We same like hypo, we keep a checkup. If the patient is not responding, or if the patient is landing into Graves' disease, or if the patient is having severe side effects, then we either surgically intervene. But this is like very rare, where we surgically intervene for a thyroidectomy, or we do a radioactive iodine therapy. Radioactive iodine therapy does nothing but it kills the normal cells and the abnormal cells, which will decrease the release of T3 and T4 hormones. Coming to the structural problems of thyroid, nothing but goiter, abnormal enlargement of the thyroid gland. What happens is, because it is situated in the neck, the enlargement of the thyroid gland, uh, once it grows outside, we can see it as a swelling. But what it grows internally, the patients present to us with throat tightness, or there's a trouble breathing, or they have a dry cough and unable to breathe while they're lying down, and these are all called as pressure symptoms, because this is showing pressure on the esophagus, that is the food pipe or the windpipe, which is causing all these symptoms. The causes may be either same like hypothyroidism, or the ones which is causing hyper. So once you see a goiter, what do we do if it is causing any kind of pressure symptoms, or it is causing any pressure on the pipes? Then we go for a surgical removal of the thyroid. And when we have to diagnose of why it is happening, then we have the main thing that comes into hand or the picture is the thyroid ultrasound or the fine needle aspiration biopsy. This fine needle aspiration biopsy is nothing but we insert a small needle, the injection needle, into the thyroid gland, and we aspirate the content of the thyroid and send it for testing. Coming to the fine needle aspiration biopsy is nothing but we take a small piece from the thyroid and we send it for histochemistry to know of why it is happening and how can we control it. So this is a small X-ray of the patient who presented to us with dry cough and unable to breathe. Unable to breathe for quite some time, and he had an obvious swelling of the neck. And when we got this X-ray done, his trachea was all shifted to the left of the patient because the right side of the thyroid gland was enlarged. Coming to the Hashimoto's thyroiditis. Hashimoto's thyroiditis, as I told you, it is an autoimmune disorder involving inflammation of the thyroid, where the ability of the thyroid gland to produce the thyroid hormones is in a gradual decline. And it occurs mostly in the middle-aged women, but can affect any person of any age and any gender. What happens in Hashimoto's thyroiditis is, if the patient is presenting to us with very minimal symptoms of thyroid, or if they're presenting to us only with a goiter, we get normal TSH, T3 and T4 done. And if the TSH is mildly elevated, not to a point where there is a requirement of supplementation of hormones, we get this anti-TPO antibodies done. These antibodies are nothing but the killers. In the normal terminology, they call the killers, which act upon the normal cells of the thyroid and they destroy them. So we get these TPO antibodies done. Coming to the symptoms, symptoms may be on physical examination, we have a goiter, elevated TSH, elevated TPO levels, and elevated and low T4 levels, low T3 levels. So what happens and what are we supposed to do? The only thing that we do is we correlate this TPO antibodies with TSH, T3, and T4. So when there is an elevated TPO and normal functioning of the thyroid, we do not give any treatment. If the TSH is mildly elevated like hypothyroidism and TPO is also elevated, then we repeat it every 3 to 4 months and we decide depending on the symptoms of the patient to whether give treatment or not. If the T3 is markedly elevated with low T3, T4 and markedly elevated TPO, we start with the treatment. Graves' disease is another autoimmune disorder. In this, there is hyperactivity or overactivity of the thyroid gland, which is nothing but the opposite of Hashimoto's. In this, the T3 and T4 are excessively produced, and the metabolism of the body won't be sufficient to utilize these T3, T4 hormones. So they will be excessively available for us. And this is also quite common in women. And over here, the main antibodies are the thyrotropin receptor antibodies or thyroid stimulating immunoglobulins, but we do not get these tested. And the main symptoms of the Graves are the popping eyes. So what happens is whenever you see a patient with Graves' disease, there is severely inflamed eyes with swelling of the tissues, which is nothing but Graves' ophthalmopathy is what we call. And the patient may have severe excessive weight loss with muscle weakness and neuropsychiatric symptoms, that is mental instability and heat intolerance. So in this, because there is excessive activity and excessive activity of the heart muscles also, there is an increase in the heart rate, which we control by using medication. And the treatment for Graves can be with antithyroid medication like methimazole, which goes again in the same way as hypothyroidism. We keep checking once in 3 to 4 months. We ask the patient for reviews. Thyroid nodules. These thyroid nodules are just but abnormal growths, maybe benign, that is non-cancerous growth, or it may be cancerous. They're usually asymptomatic, however, may present with hyperthyroidism. So what do? We either do a radiation therapy, or if the patient is totally asymptomatic, we do not do anything much. If the patient is symptomatic, then yes, we try ablating it, radio frequency ablation or radioactive iodine. And how do we prevent? This is where we come to the main topic. How do we prevent? The only way or the most important way of prevention of thyroid dysfunction is the iodine intake. And in the developing countries, the iodine intake is enhanced, or it is enhanced only by the salt, that is adding iodine to the table salt. So these are the common sources of iodine, and we should thank the government of all the developing countries who are encouraging the iodized salt, or who are using various methods of advertising to enhance to show the people the importance of iodine in a normal table salt or in any form of supplements. So the most common sources of iodine are nothing but salt, and then coming to the foods, seafoods, legumes, and the other one is iodine supplements. So this is just a recap of whatever I've told. The main thing that I want to talk about here is the thyroid disorders in or during pregnancy. I've seen that a couple of women have joined this. So I just want to make aware of how it generally goes during pregnancy. So in pregnancy, the metabolism of our body, it remains the same, but we need to provide these hormones even for the fetus, that is the baby within us. So sometimes when you are in hypothyroidism patient, known hypothyroidism patient, the requirement of your tablets may go up a bit during the first and second trimester, or even during the third trimester of pregnancy. That is because you have to provide these hormones just not to yourself, but even to the baby. Same way with the hyperthyroidism also. In hyperthyroidism, we do not choose methimazole as the treatment, but we shift it to you propylthiouracil, that is PTU, which is safe in pregnancy and can be used in pregnancy. But the only thing that we are worried about hyperthyroidism in pregnancy is the child. Once we are giving anti-thyroid medication during pregnancy, we are very careful about the child. So once after the delivery, we keep checking on the child if the baby is having any kind of or any symptoms of hypothyroidism, and we do send for testing at birth and followed by 6 weeks, and then later on also we keep checking the child if the child is having any symptoms of hypothyroidism or any blood workup which is suggesting of hypothyroidism. So what if the patient has any thyroid nodules or any Graves' disease, thyroid nodules or detected thyroid carcinoma during pregnancy? Generally, we ask the patient to wait for the delivery to happen and then we offer surgery. If we are unable to wait, then second trimester, that is nothing but 3 to 6 months, is a good time for surgery. And these medications, which are the dosages of these medications, which are increased during the pregnancy, will come back to the pre-pregnancy medication probably after delivery or within 6 weeks of delivery, that you can come back to your normal pre-pregnancy dosages. But that too only after the advice of a doctor and after getting your T3, T4 or TSH done. And this TSH, normal values of TSH will abnormally change or abnormally be restricted during pregnancies. So this is a small picture of the goiter. This is how it presents. So this I can say it is not total expansion of the thyroid gland, but I would say only the right side. It is just one lobe of the thyroid that is enlargement, and I can see this more as a thyroid nodule rather than goiter. So this is how thyroid nodules develop. It is not the whole of the thyroid gland is normal. It is just a part or a small a fusion of cells that becomes abnormal, that have an abnormal growth and become into nodules. So these nodules can be either benign, that is non-cancerous, or they can be into or they can be cancerous also. So only it is like a very minimal population that have thyroid cancers, but there are a different type of thyroid cancers depending on the histopathology of the cells. And the treatment of all different types of thyroid cancers will vary according to the histopathology. So coming to diagnosis of any thyroid disorders, like how I kept on repeating, T3, T4, and TSH are the main tests that we do or we rely upon. TSH, T3, and T4 are varied. Like even if there is a minute decrease in T3, T4, there will be a huge difference in the TSH. They're ultra sensitive, and that is the reason that we are very careful when we are doing a T3, T4, and TSH. Along with T3, T4, and TSH, we are very particular that we get a free T4 done to check if we need to alter any medication. Along with this, a lot of imaging, ultrasound test, and fine needle aspirations, then thyroid scans using radioactive iodine. All of these can be used for diagnosis of thyroid disorders.
Yeah, hi Soumya. I have one question.
Yeah, please.
Regarding this free T4 that you are saying, like
yes.
So what if T3 and T4 is normal and free T4 is not normal. So do we have
So
such case possible, or?
yes. See, T3 and T4 are protein bound. So it is only the free T4 that is available for the metabolism. So we are more keen on FT4 also. Sometimes the TSH may be slightly elevated with normal T3 and T4. But at this case, if the TPO antibodies are raised or if the FT4 is slightly altered or decreased, then yes, we go ahead with the treatment. And that too, taking the clinical scenario of the patient.
Okay.
Yes, FT4 is very important and a very vital test in in deciding the treatment changes.
Okay. So you mean like a dosage increase or decrease, whatever?
Yes. Changes of dosages, we particularly go ahead only with FT4 and TSH.
Okay. Yeah. Thank you.
Yeah, that is more important while we are changing or deciding on the dosages of treatment.
Okay. Mhm.
Yes, any questions?
Yeah, hi. I have one question. We generally check up for my wife. So her T3 and T4 are normal, but TSH is a little bit vary.
So,
So
like
is
how
there any
much?
specific reason?
So, see one thing. What there are two things. One is subclinical hypothyroidism, in which TSH is not that markedly raised, but in the borderline, somewhere around 6 or 7, and the patient is absolutely having no symptoms with a normal T3, T4, and FT4. Then we do not give any kind of treatment. We ask them to change their lifestyle, like the iodine intake. If the patient is a smoker or alcoholic, then we ask them to stop it, go for a physical activity in the form of cardio for 3 to 5 times in a day, and then we recheck or ask the patient to be under follow-up for every 3 months, that is 12 weeks.
Yeah, actually, she's in a pregnancy.
Okay.
So doctor suggested to use tablets like
So
thyroid
in pregnancies, the scenario will change.
Okay.
The scenario in pregnancies is even a small alteration in the TSH, we do not wait. We start with treatment.
Yes. Yeah, earlier, before 1 month, 2 months back, it's 7.2. Now it's 1 month back, we checked, it's 5.84.
So which trimester of pregnancy? Which month of pregnancy? Sorry.
It's now she is in 5th month.
And how much is it now?
1 month back, we checked, it's 5.84.
So I think she needs to be more aggressively treated. I think the dosage has to be increased.
Yeah, last time she increased earlier 25 mg, now increased to 50 mg.
Yes, I think 50 mcg will be doing, but so this changes in the dosages or the newly diagnosed hypothyroidism in pregnancy, the medications will get altered after the delivery. They may not require so much dosage after delivery.
Do we need to do any exercises or any things to reduce this thyroid?
So, because you're saying she's a pregnant lady, I would suggest you to take the opinion of a gynecologist before she starts any physical activity. If everything is normal, her scans are normal, and if she's an active woman, yes, probably just a little iodine intake along with cardio, the basic cardio, what they can do in their second trimester. But they won't be changing much in pregnancy. The thyroid panel wouldn't be changing much during pregnancy because it is even the child that requires T3 and T4. It is not just the mother. So the supplementation will keep continuing. The only thing that may change is the dosage may not get increased.
Okay. Yeah. We need to check every month this
Yes, sir.
thyroid.
Yes, sir. Every 4 to 6 weeks during pregnancy.
Okay. Thank you. Thank you very much.
I just had some message from M. Deepthi. sorry, can I take names? Okay. I had a message. T3, T4, and FT4 are in normal range, but TSH is 55. Um, yes, if the TSH is 55, the patient is having symptoms or not having symptoms, we would go ahead with the treatment. Because 55 is a huge number and we do not wait. We wait only till the TSH is around 10, not more than 10. It is only till 10 that we consider the lifestyle changes or we say it is a subclinical hypothyroidism. But with 55, we cannot wait. We need to start treatment. We need to start treating the patient.
If anyone have any questions, please unmute yourself and you can ask your questions.
You can send me a direct message if you don't want to ask me any personal question or anything. So I just have one small question. How many of you ever got a thyroid test done? I'm sure most of you must have. Can I see a raise of hands or how do I monitor here? So I have another question. Hand tremors for hypothyroidism, how is it different from tremors in Parkinson's? Parkinson's has a very typical hand tremor where it has a pill rolling type of tremors. And the symptoms of Parkinson's are totally different from the symptoms of hypothyroidism. When we see a patient of Parkinson's, they are expressionless. They are very slow. The kind of walk that they have is totally different. And they're very slow, very relaxed people with a very typical type of pill rolling. That is nothing but they have a pill rolling type of tremor. But coming to hypothyroidism, they're very anxious. Once you see the patient, you can clearly say that the patient is very anxious. That is how hypothyroidism presents. And they have a fine tremor. It doesn't involve one or two fingers, or it doesn't like it involves the whole of their hands. You can see a fine tremor running through it. You see the changes in their skin. The skin is moist, they're sweating, they're anxious. You can see the changes in their eyes. They're all very typical of hyperthyroidism. Hyperthyroidism and Parkinson tremors are totally different. These are tremors. That is a different. I mean, this tremors involves the hand. The tremors is like a typical pill rolling type of tremor. So what happens if you miss your dosages once in a while? You can't miss. The simple answer, we don't miss any important activity in our daily life. Even thyroid medication is also the same. You cannot miss your thyroid medication once in a while. That indirectly implies in the testing what we do, T3, T4 and TSH does get altered with your missing of medication. And it is like a normal, I mean, it is like a regular thing. It is like a part of your life. You cannot skip your medication in between. And to be very clear, that the medicine has to be taken only on a fasting state. You have to wait for half an hour after taking the medication. This is very important because it enhances the absorption of the thyroid tablet. So you have to be on a fasting state after taking the medication.
Hi, Sachita this side. Actually, I have one question.
Yeah, please.
4 months back, I got the test and the blood test for THS. I have hypothyroid, and 4 months back, my reports were fine. Those were in range, but I right now I'm taking 25 mg tablets daily.
It is not
And
mg. It is not mg. It is not milligram. It is mcg. It is microgram.
mcg. Yeah, correct.
Yes.
And like last month, like 15 days back, again I got the test, and my blood reports were not fine. It was bit higher than the range. It was like 5.25 something. But I am taking the same medicine. Do I need to consult to the doctor? Because within three,
What
four
was
months,
your report 4 months back?
it was under 3.25 range.
But 3.25, but why did you start medication when it was normal?
I have thyroid issue. That's why doctor asked me to. Yeah, it's
Okay.
been like 8-9 years.
Okay, so you're a known
Yeah.
thyroid patient who's been taking 25 mcg from before, that is like 8-9 years.
Yeah.
And then it's always under normal, but it is only once that you've seen abnormal.
Yeah.
You can do one thing. First thing is you can repeat your test after 4 to 6 weeks, the TSH and FT4 this time. And if the TSH is still high, like 5-point change or 6 change, then yes, I
Mm-hmm.
would say increase in the medication.
Oh,
Until then,
okay.
you can start your lifestyle modification, that is adding a little iodine into your diet. And second thing is just a small physical activity in the form of cardio for 5 days in a week.
Okay, fine. Thank you.
No problem. Is it compulsory to take medicine at the same time daily? No, it is not same time daily, but it is compulsory that you take it in a fasting state every day. Are diseases related to thyroid for life? As in, once affected, it goes on. See, it is not completely curable, first thing, and it is not a disease. Second, see, are diseases related to thyroid for life? Thyroid, these are disorders, they are not diseases. Your thyroid is not diseased, it is just a slightly functioning a little low. See, like we are on our low days, we don't feel like getting up, we are a little lazy. So that is what happens with thyroid also. It is a little lazy to release hormones, but it doesn't have any problem. Yes, and once you start treatment, generally it is for life. And if somebody, we have a lot of patients who who have stopped treatment saying that we want to take homeopathy or Ayurvedam, we leave it to the patient. See, the opinion of the patient is also very important. When they say that they want to try another different medication, you can try, but the only thing that we ask is keep getting a test done. See, even when you're on a homeopathy medicine, you need to keep your test you need to keep getting your test done once in 3 months, at least 12 weeks, once in 12 weeks, to see if your homeopathy medicine or your allopathy or your Ayurvedic medicine is working and if your thyroid's hormones are normal or not. I mean, that is if they're balanced or not. I'm feeling wet cough for from long time. This will be allergy, or is it because of thyroid? Should I go for a thyroid test? Wet cough is surely not a sign of.
Doctor, I would request you to also read out those questions that are coming out to your personal window so that everybody can understand the context as well.
Okay.
Please don't share the names because they want to have it privately answered.
Okay, yeah, sure. Sorry, but I've just taken one name. I'm so sorry to them. I didn't see that it was a direct message to me. And yes, the answer that I've told, that lifetime, that it has to go lifetime. The question was, are diseases related to thyroid for life? As in, once affected, it goes on for lifetime, or is it completely curable? That was the one I answered. And is it compulsory to take medicine at the same time daily, is what I answered, that you have to be taking it in the fasting state every day. See, because sometimes you get up at 7, sometimes you get up at 9, whatever it is, as soon as you get up, the first thing that you need to do is taking a thyroid pill. If the value of TSH, if TH, I take it as TSH, if the TSH value is 6.7 in any issue, if yes, how to control? Please let us know. 6.78, we would consider it as subclinical hypothyroidism. That is, if your FT4, T3, T4, FT4, TPO antibodies are normal. At this point, we would ask you to lose some weight, do some exercises, that is cardio, take iodized salt, avoid cauliflower, cabbage, and broccoli, and get it checked after 12 weeks. The other question is, I'm feeling wet cough from long. This will be allergy, or is it because of thyroid? Should I go for thyroid test? Wet cough is surely not a symptom of thyroid. It could be because of allergy. But if you're having any other symptom along with wet cough, like any weight changes, or if you're having any period abnormalities if you're a female, or else if you're having any hair fall or any dry skin, low metabolism, and you're lazy most of the times, then yes, go ahead with the thyroid test. But as such, only for wet cough, I wouldn't suggest. I would rather ask you to find out the cause for wet cough, but I don't think it is related anywhere to the thyroid. What type of diet should we take for thyroid people and for prevention is the question. Iodized rich salt, first thing, to avoid cabbage, cauliflower, and broccoli. This is the only diet that we suggest to any patient, and we would suggest that we would suggest them to have a balanced diet. Then rather going on any diets to lose weight, then we would ask them to go on a balanced diet and lose weight in a proper manner. Because once the weight comes down, indirectly the requirement of T3, T4 hormones also will come down. Once we are giving a thyroid tablet to any patient, the first thing that we consider is their body weight. First, we check the weight of the body and then we start treatment. So if you really don't want to go there when you're in subclinical thyroidism, lose some weight so that the requirement also will obviously come down. Can we have water before medication in the morning? I would suggest tablet first and then water. But you can have, nothing will change. But as a norm, the alteration in the absorption of T4 hormone or T3 hormone will have a drastic change after having food or after having anything. So first thing first go for a thyroid patient is the tablet.
We have 5 more minutes to go. If anybody has any further questions, please feel free to use this time and ask doctor the questions. I think we have one more here, doctor. I have seen some videos that are saying without medication we can control thyroid by yoga asana. Is it true?
That's what I was trying to tell. Homeopathy, Ayurvedam, allopathy, yoga, whatever it is you want to try, the opinion of the patient or opinion of the opposite person is very important to us and we consider it a lot. But I haven't seen any patient who's come back to me saying that the thyroid has come into control with a yoga asana. On a personal note, I haven't even read it anywhere also. Yes, maybe this yoga asanas and everything will help you in losing weight, indirectly decreasing the requirement of your T3, T4 hormones. But as such, for the functioning of thyroid is a little questionable.
I hope that answers your question, Monica. Any further questions, everyone?
Okay, I have a direct message for someone who is losing weight due to thyroid. What should be the diet for her? See, I wouldn't suggest any particular diet for a patient who is a thyroid and wants to lose weight, but I would ask them to rather work out more than what a normal person is doing, because their metabolism is low. See, like if a normal person is losing around 3 to 4 kgs in a month by doing a normal simple cardio, a patient with hypothyroidism, because their metabolism is a little low, probably can go up to 2.5 kgs. That is, I would say that their metabolism would be around 15% low than a normal person. So I would suggest them to work out more and have a balanced diet. Okay, other question is, sorry, I missed the question. Okay, what are the reasons for thyroid? The main thing is lifestyle, cigarettes. See, before we used to talk only about iodine as the main reason for thyroid, and the autoimmune. See, autoimmune is not preventable. We cannot do anything about it. But diet, yes, iodized salt. And recent times, thyroid, I mean, we are giving more importance even to smoking and alcohol also. So even the cessation of smoking and stopping of alcohol are also very important in regulating the thyroid. If TSH is 6.78, do I need medicine if you're not having any symptoms? If your T3, T4 are normal, no medication is required. A direct message, why these days people are getting it more? Because of our lifestyle. Simple answer, it is because of our lifestyle and because of our less importance that we are giving to our health. See, I've never seen my mom or grandmother talking about burgers, pizzas, or sitting lifestyle. This is what has increased these days, and this is what is leading to all these lifestyle disorders. All these are lifestyle disorders: thyroid, BP, sugars, because of the change in our lifestyle. Our parents or our grandparents were out in the fields or were outside in the house working, doing their stuff, maintaining a balanced diet by eating more of vegetables or the homegrown crop. But that is what is lacking with the generation now or the upcoming generation also. So I would rather be more worried about the kids of this age, who are more into outside food cultures which are not ours, who are more adamant on eating outside, and the foods which we are not used to. These are not locally grown foods what they're adapting to. So that is why we are more worried about hypertension, diabetes, thyroid, obesity, all these lifestyle problems like PCOS in females.
Thank you so much, Dr. Soumya. It was very, very insightful, and I think we have a lot of tips to go back with and to ensure that we are on the best side of our health. Thank you so much. I really appreciate it.
Thank you so much. But I was expecting one question from one of you, that why do we get a thyroid test done only on fasting state? But I was so surprised that I didn't get this question.
So we have to answer that then.
Because one in like 2 patients who come to me ask me, can I get a thyroid test done after eating? Then I would say, surely say, see, because thyroid T3 and T4, these are protein bound, there is a lot of fluctuation after you eat. So we suggest only on fasting state. And if you're on treatment, already known hypothyroidism, maybe once in a while after eating is okay. But for a newly diagnosing, we would suggest only on a fasting state.
There was one more question related to this that I would ask Dr. Soumya. Somebody was asking, can they drink water before the medication?
I just answered them.
Oh, you did. I'm sorry.
Yes, I did answer them. And
so it's a yes or no to that?
I would say first medicine and then water. Okay. But if they're real, see, because even medicine is taken by water. So it doesn't, that's a very small pill what we suggest. It wouldn't really change their thirst by that small tablet. So you can just have a small pill and take water. 2 of you can find these preventive measures useful so that you don't progress into the next half of the problem.
I'm sure they will. And thank you all of you for making the session also so interactive. You've been very participative and very interactive. Thank you once again. Thank you so much.
And thank you. Thank you so much.